Does it feel like your pelvis is ripping in half, like you're being broke open? It is the most uncomfortable feeling. It often happens when you step off a curb the wrong way, or when you roll over in bed, or getting in and out of the car. Any kind of motion that is going to stress what is called your pubic symphysis joint can give you pain in that joint, and that pain can lead to inflammation in that joint. Why does this happen? This happens because during pregnancy, we get an influx of relaxin, progesterone, and what those hormones do is they increase the flexibility of the joints themselves. And that can be really good and helpful for helping get the baby out of the body when you're in the delivery room. But for the 40 weeks that you're not in the delivery room, it is not helpful because we need it, right? Our bodies are changing and that's all good and dandy. But we often will suffer with a lot of pain at that pubic symphysis joint. So it's called pubic symphysis dysfunction, or symphysis pubis, you might hear it called. And simply what it is, it's just an irritation at that joint. And so at this point, you're probably like, lady, just tell me how to fix it because I cannot sleep at night because I cannot roll over in my bed. Let me tell you, when you go to roll over in your bed, what you're going to want to do is when you roll over, you exhale, and then you bend one knee that you're not rolling towards. So if you're rolling to your left, you're going to bend your right knee, exhale, shh, and push towards your left through the entirety of your foot and roll over. And then you want to make sure that you got some pillows between your knees, that you have a little towel roll supporting the belly underneath you, and that when you're on your side, your spine is as aligned as humanly possible. If you allow your knees to come together when you're sleeping, that's going to put a little bit more stress on that pubic symphysis joint. And so these are just some considerations to really take the stress off that pubic symphysis joint and help get rid of the pubic symphysis pain. Again, you don't want to like grit your teeth through this type of pain. If you have this type of pain, your pelvic floor is getting super tight, trying to protect your body from this type of pain. If your pelvic floor is getting tight, that is not helpful for birth. So definitely go check out some of our other videos that we talk all about diaphragmatic breathing and breathing the baby out, and that will also help you deal with this pubic symphysis pain. Okay, the next tip I want to give you before you run off and, try to solve this pain is you have to figure out how to get in and out of the car without irritating your pubic symphysis. And that's one of the hardest things to do. So my simple tip for you is every time you get into your car, you want to pretend like you're 80 years old. You ever watched an 80-year-old get in and out of the car? They usually sit their booty down and then walk a leg in and then walk the other leg in. You got to do the same thing. Even if you drive a big fat SUV or your car is elevated, you want to step up onto a ledge, stick your booty on the chair first, then bring one leg in and then bring the other leg in. That is going to help you take the stress off the pubic symphysis joint. Because if you just step into the car, you're putting all your weight on one foot, that's going to create a lot of shearing force at that pubic symphysis joint. So those are two things you absolutely want to adapt. The other things that I would avoid while you are having any bouts of pubic symphysis pain would be to avoid any single leg strengthening exercises and or lunges. They can be really aggravating for the pubic symphysis joint just because the legs are in different planes, and then it's a lot of force just through one side of the pelvis. So avoid the single leg stuff and avoid the lunges for the time being. Of course, working with a pelvic expert physical therapist who can help resolve this pain before delivery is the most ideal circumstance, because if you are having pubic symphysis pain, it is going to be really hard for you to spread your legs open so the baby can get out of the body, right? Because you got to be able to spread your legs, and a lot of times with pubic symphysis pain, just spreading the legs is really uncomfortable. We like to say stretch everything that attaches to the pelvis, try to balance your muscles on each side of your body. This means doing some glute stretches, doing some inner thigh stretches, doing some hamstring stretches. Those can all be extremely beneficial for you in order to help battle the pubic symphysis pain. The stretches should never inflict any pain. So I hope this helps you cure your pubic symphysis pain and get you ready for the birth of your dreams. I'm Dr. Allison Feldt, owner of Body Motion Physical Therapy. If you want more information, download my free birth guide and a little trial tool to give you tips to prepare your body for the birth of your dreams. Bonus points is that this will help you deal with your pubic symphysis pain and get rid of it. Take care.